So lupus and fatigue is obviously a really important topic. It's often not addressed well and is such an important part of feeling well with lupus that I want to take you through some important information and sort of give you a framework of how to think about fatigue and how to feel better, and also to communicate better with your doctor so that they can help you feel as good as possible. So what is fatigue actually? A lot of people will say, oh yeah, I'm tired too. When you tell them, I'm just very tired, the lupus is very active and I'm just feeling really tired. And, oh yeah, me too, a tough day at work. But fatigue and lupus is just completely different. It is a lack of energy even after you've fully rested. So you can have a complete night of rest and just still feel not good and feel really tired, like you want to just go right back to bed. Often people say it feels like having the flu, something you just can't get on top of. And the definitions, I think, really clarify this. So fatigue is really described as an overwhelming and sustained, I think sustained is the key word here, sense of exhaustion and decreased capacity for mental and physical work. And probably you've all experienced this. So you get to work or you get involved in a project and your body and your brain just doesn't allow you to continue. And that's really what fatigue is. And we call it chronic. Chronic fatigue is a separate condition, but I think chronic fatigue just speaks to the fact that this can go on until it's addressed properly. And so I hope we can talk about how to break that cycle today. So this is a word cloud, and for those who may not be familiar with it, it's created, the computer creates it when a bunch of people sort of put a word or put ideas into the program. And if you say to a patient, what is lupus? These are the variety of responses you get, or at least this is one word cloud. And as you can see here, fatigue is really front and center. It's quite huge. There's a lot of other familiar words in there, but fatigue, I was so amazed how it really is right there in front. And it just seems so appropriate to me because while you're dealing with joint pain and all these other problems, the fatigue you have is really pervasive and really kind of overlies all the problems in lupus. So the interesting fact about fatigue and lupus is that it's very common. In fact, 2/3 of lupus patients report having significant fatigue, and a third will actually say it's quite severe of that group. Patients will often report it as the most bothersome symptom. So they might have pain. I mean, sometimes pain is quite severe, but at other times patients will have pain, but say, no, that's annoying, but what really keeps me from having a quality of life is the fatigue. That may not be true for everyone, but that can occur. Fatigue is not always related to disease activity, though. So it's important to think about that so you can really unpack what's going on when you're feeling that fatigue has taken over what's going on with you. And the one thing for sure is that I think both patients, but especially healthcare professionals, just don't understand enough about how to have a conversation and assess fatigue. And I think it's important to work together to get at that. So I want to give you some tools today. Obviously, sometimes you're going to your doctor with an acute problem, a joint hurts, or a blood test is off, or something is going on that's sort of front and center for them. So I think it can get pushed aside. I think that's not something doctors intend to do, but I think that when there's so much to take care of, the prescriptions and everything you have to put into the computer, sometimes we're just not focusing enough on fatigue. So finding a way to refocus is, I think, so important. As this diagram illustrates so beautifully, fatigue and lupus isn't just one thing. So as I mentioned, it can be part of disease activity, and that can be for many reasons. Anemia related to lupus can cause fatigue, but so can just lupus itself. Having joints that are sore and don't work properly certainly can be part of disease activity and lead to fatigue and lupus. But as you can see, there's a bunch of other things here. And so, for example, something that we might refer to as damage, which I don't love that word, but I think maybe chronic problems related to lupus is a better term. But for instance, if a joint doesn't work well, or a muscle's been inflamed over and over again, it just may not work to capacity. It may not work. It may require a lot of extra effort for your body to overcome the fact that that particular part of the body is not performing. So that's one possibility. The other is everything else. So lupus patients are also patients and people who have every other thing that everybody else gets. So they can get infections, they can have diabetes, they can have thyroid problems. So it's important not to just blame everything on lupus, but to think about what else can be happening. Also, medications, while really great at addressing a lot of the things that we need them for, some medications can have side effects, and fatigue can be one of them. And we'll talk about that as well. And obviously pain just makes you weary. It really itself can just deplete you of energy, but it can also cause anxiety and depression, which we're going to touch on as well. And that can lead to fatigue and fibromyalgia, which some of you may have experienced, but also an inability to get refreshing sleep. And certainly that's not going to help when you have lupus if you're already fatigued, and then on top of that, you're not getting refreshing sleep. So how do you go about starting a conversation with your doctor about fatigue? And I think it's so important when you're seeing the doctor to have a few things jotted down about what's important to you to address for the day. So if fatigue is really bothersome and really front and center for you, I think you should bring it up early in the conversation so that it doesn't get lost. I think a lot of interactions with patients that I've had, sometimes the patient's waiting until the end because they think that that's not an important thing to bring up. So it's not brought up in the beginning. So I would encourage you to start that conversation early in the visit. So this checklist sort of helps you think about how you would begin that conversation and how you would begin to assess fatigue with your doctor. So in the first part of the list, you can see characterizing the fatigue is really important. And that's something actually that we need your help with, because characterizing fatigue is something you would be the expert on. And so that's an important way to start the conversation. I think something that you could also help us with, and we should be exploring with you, would be what's going on in your life and your habits and your sleep, so we understand how it's actually impacting on your life. And then there are other things such as, are there other medical problems going on? Let's go over your medications and make sure they're up to date. Those are really something that we're supposed to be doing and sort of bringing to this conversation. So let's sort of talk about the first two things and the questions that we should be asking you, and you can be reminding us of these things as well. So what are your daily activities? Are you getting out? Are you spending all day in bed because you're just too tired? Or are you exercising? I mean, I think these are really important in understanding how somebody's doing. Because if they're not able to do the things they want to and need to do, that's a problem that needs to be looked at. How often do you feel fatigued? Is it something that only comes up when you're having a flare and now you're not having a flare, so you're feeling well? Or is it something that's more constant throughout the day? What are the causes of your fatigue? I think it's so important to ask the patient, because you don't really want to assume what the cause is as the physician. And often patients will say, oh yeah, no, I'm fatigued, but I went for 2 hikes and I went 20 miles. Okay, that's good. That's good fatigue. But asking a patient what they think the causes of the fatigue, I find is so helpful, because they often will give you very valuable information. What are the consequences of your fatigue on your daily life? So if a woman tells me, I'm so tired, I can't hold my baby to breastfeed, or, I mean, that's a crisis. We need to really understand what the consequences are for your overall well-being. How do you cope with your fatigue? Because it may be a problem, but you may be coping with it well, or it may be a very small problem and you're not coping well. So I think that's important, because some problems are not totally fixable, but sometimes coping mechanisms can help improve the situation. And I always like to ask people, what resources do you have? What other things are people doing to help you lessen your fatigue? And I have some thoughts on that. I feel that many people don't always want to ask for help, and I can understand why that would exist, but I think it's just important to think about resources and what's around you. So another way to measure fatigue is similar to asking people about pain. Can you give me an idea of your pain from 0 to 10? I sometimes will say, rate your fatigue for me from 0 to 10, if 10 is the worst. This is what we call a visual analog scale, and it's sort of very similar. So no fatigue would be 0, worst possible fatigue would be a 10. But I think in research in general, this has been shown to be better at really capturing the level, because it doesn't actually get a person to commit to a number. So you just put a mark on the line and then you go back and measure it. And so these things are used often in research, but can be very valuable when you're talking to the patient. This is really more a research tool. If you've been involved in any research studies, you may have filled one of these out. It's sort of fun to go back and go through this on your own and see what your number is. And I don't know, maybe it's a tool to follow. I don't know if you follow other things about your disease activity. Maybe this is something you could use to help yourself understand if you're getting better or worse. But this is mostly used in research. is obviously trying to get at how bad the fatigue is, so that the larger numbers are worse and the lower numbers are less. But that's sort of a research tool. This is something I learned from a patient a long time ago, and is, I think, really taken off. But I like it because it's sort of, I think the patients come up with the best things, and this is really clearly, obviously, something a patient came up with. So the idea is, if you only had 12 spoons to use throughout the day, how would you use them? And I always thought about that, and I sort of like, why spoons? For me, I sort of feel like, why not gas? But gas is, of course, very hard to measure. So the spoons work really well, and I really like this cartoon, which, as you can see with the references here, I took off the internet, but it kind of tells you, one spoon is getting dressed and maybe more sedentary things, but if you're going to go shopping, that's going to be 4 spoons. So don't be surprised if you run out. And then if you're going to the doctor that day, you've used like most of the spoons for the day. So don't expect that you're then going to do the laundry and go out with friends, and your body's not going to let you do that. And you know what? That's okay. And this tells you that makes sense. And so I really like this. And it might be a way for you to understand, why certain things are just too much, because, if you only have 12 spoons, you're just not going to do it all. So now I want to move to talking a little more about medications and the types that might cause fatigue or make it worse. Now, I just want to remind everyone that everyone's bodies are very different, and I really wouldn't want to encourage anybody to take away that a medication that we talk about here is the cause of their fatigue and to discontinue. Please speak with your physician. This is just a way to open that conversation, but everyone's so different. I wouldn't want to give blanket advice to the group. But we all know, for instance, cold and allergy medications like Benadryl. I don't know if you guys have ever had an infusion. They sometimes use Benadryl before the infusion. Sometimes people will feel very sleepy after Benadryl. Certain muscle relaxants, if you're having back spasm, those can cause fatigue for some people. Rarely, I would say, there are some blood pressure medications that cause fatigue, but I would say that, to me, is rarer. We all know that there are pain medications that can cause fatigue. Fortunately, we try and reserve these for situations where people, are recovering from surgery, and try not to use these long term, but some of these medications for pain can cause fatigue. Now, what's interesting is that medications that cause fatigue when you first start them don't always cause fatigue forever. So it's just something to think about, because I would certainly be unhappy if I took a pill my doctor gave me and all of a sudden I was very tired. But some of these, over time, those symptoms can get better. So think about discussing that with your doctor if that's happening. There are also, I find this to be quite rare, but as some antidepressants are used for pain, and they can be complicated because of the effects on the nervous system, can be potentially make fatigue come out, and some anti-seizure medications as well. So what about medical conditions? What kinds of medical problems cause fatigue or can make it worse? Well, we all know inflammation or disease activity. We kind of touched on that. And when your disease is active, everyone has different lupus manifestations, but some people have fatigue, rash, joint pain. But I find patients are the experts. You know, I had the emergency room call me on a patient once and, oh, your patient's here. I'm not sure if she's flaring. So I walked in the room and I said, are you flaring? And she said, no, I told them I'm not flaring. And I said, nope, she's not flaring. So I have patients know their lupus better than anyone. So I always go right to the patient on this. But for people who like, you know, hardcore data, sometimes there are things in the labs that can show that. You may have heard your doctor talk about sed rate or complements or DNA, or to me, those never trump the patient. So again, you guys are the experts. Anemia, as I mentioned, when your blood counts, your red blood counts go low, sometimes that can cause fatigue because those red cells will actually deliver oxygen to tissues. And if that's not happening as efficiently as it should, that can lead to fatigue. Usually mild anemia doesn't as much, but it's complicated when you have a lot of medical problems. It's possible even a bit of anemia could contribute. Thyroid problems are a big cause of fatigue. So those are the one, that's the thing I'm always trying to rule out as a contributor. Infections, if you've ever had an infection, it can the fatigue can kind of hit you before you even realize that you have the infection. And we talked about the medication side effects. Insomnia is a huge fatigue problem. So by insomnia, I mean the inability to fall asleep or stay asleep, so that you don't actually spend enough time resting, because you really need that time for your body to repair. And that can have many causes. So it's important to think about. A lot of times, it seems like a pill would be nice just to fix it easily, but it's actually not that simple, because not sleeping can be due to a lot of things. So if it's pain, just knocking someone out with a pill really isn't addressing the pain. And what about if you're taking steroids and you have to take a dose later in the day? Sometimes that can interfere with sleep. So, you know, perhaps changing the way they're taken. Again, please don't change anything without your doctor if you are taking it later in the day. But, you know, these are the kinds of things to bring to the table and have a conversation about. I actually think poor sleep hygiene is probably the #1 answer for why people have insomnia. So I know my favorite time to sort of surf like the web and social media and all that is, you know, for some reason, 12 a.m., I guess. And, you know, that's just not good. All that light bombards your brain and makes it very awake. There's some settings that can minimize that reduce the type of light. So that's something, but, you know, really committing to stopping an hour before you go to sleep, not putting the TV in your bedroom. I know that's sad, but many things like that. Some people even think digital alarm clocks that kind of light can contribute. So just look around your bedroom and see what's there that may be preventing you from actually, you know, getting into a good sleep mindedness. Worries, anxiety. I mean, who doesn't have anxiety and worries these days? I mean, you know, if you're like me, you're worrying about, you know, other people in your family. Are they going to get sick? I mean, is it okay to go back to work, or are you going to get sick? It's a lot to think about right now. Too much to do. If you're busy, I mean, it's just very common to just keep going, right? Oh, it's 12, but I just have to finish this, or I just have to, you know, write my holiday cards and just keep going. So don't cut into sleep time. Prioritize sleep. It's just as important as the other things that you have to do. And then there are some other causes that are things that can be investigated, like sleep apnea. If you have sleep apnea, you're not going to get refreshing sleep. So that's something that can be really investigated with a study. Depression and fatigue really do go hand in hand. And I have to say, social distancing during the pandemic and the inability to be close with loved ones can be depressing. I know I'm very close to my mother, and I just decided I wouldn't see her so that she would be safe. But it was painful not to be able to hug her and just to be with her physically, even if I could see her on FaceTime. And I'm sure this resonates with you. Not exercising, I think, you know, when you're in lockdown and the gym's closed, I think it kind of gives you like a mental reset. And also it just, I feel like the efficiency that your body gets from exercising and having muscles that work well, if you're not exercising, that diminishes, and then you can become fatigued more easily. And obviously the mechanisms involved in lupus and how lupus affects the brain are consideration as well. It's interesting that up to 50% of our patients actually will exhibit some depression-like symptoms, even if it's not officially a diagnosis. And studies have shown that higher levels of pain and fatigue were associated with higher levels of disease activity, not surprisingly. And that something called tumor necrosis factor, so it's a factor in the immune system that becomes higher when lupus and other inflammation is active. That this was associated with more severe depression-like symptoms. So this is just to say that it's not just what we observe when we talk to you, it's also scientifically proven. And of course, there's COVID. Fatigue has been a really common thing during the epidemic. And it's been shown in studies that patients have very high levels of fatigue and something called anhedonia, which is just not feeling happy, not feeling pleasure after they've recovered from the infection. So you'd think that once you feel physically better, you'd feel mentally better, but it appears that's not the case. You know, up to half of our patients are saying they still feel fatigue. A lot of people have referred to this as post-COVID syndrome. And, you know, I think it's really common after viral infections to have fatigue. So, you know, while it may be helpful to classify some symptoms as post-COVID and, you know, long haulers and all this stuff, I think it remains to be seen, but it's very clear patients continue to have fatigue. It's interesting that I found this very interesting, that the severity of the effect of the infection with COVID does not actually predict the amount of fatigue that you might have after. So that is why I think a lot of us have said, you know, we still have to be vigilant. We still would like people to get vaccinated, and because any infection can have consequences, even if it's mild. The interesting thing here is that there was no association between fatigue and things that you could actually measure in the blood. So I just think we don't yet know enough about COVID. I know people get frustrated because on TV they're changing the story all the time, but it's because we're learning all the time, and the virus is changing. As you know, new versions are coming out. So I think with what we've learned, this flow chart is really helpful and applies. So when we think of managing fatigue, we know that you have lupus. We know that that's there, but check for other causes of lupus fatigue. Make sure you do that so that you don't miss anything, and ask, is lupus actually active as well? And if lupus is active. Obviously, controlling disease activity is important, and it may actually help with the fatigue. Not always, but it's important to do that. On the other hand, if lupus doesn't seem active, you really do have to go through those other things that we talked about and try and target those as well. So as you can see here, targeted interventions are really the name of the game. And of course, reassessing fatigue. So it's not something that's going to have one answer. It's something that you're working at constantly, just like you are working on lupus. It doesn't have one answer. There have been quite a few research studies, which I know that I thought you would be interested in about fatigue specifically in lupus. One point of interest always with my patients is whether vitamins can work and for fatigue in lupus. So they did a study looking at vitamin D supplementation, and it did improve fatigue scores for patients. And I should say that they went a little further and then looked at whether it had value in lupus. And I think the majority of the evidence would agree that vitamin D did not protect against lupus becoming active. So, you know, I'm not sure why this is, but for some people, particularly if the vitamin D levels are low, sometimes supplements can be helpful. Now, there are reasons not to take vitamins, so I don't want to sound like a broken record, but it's very easy to think vitamins are safe because they're just sitting there in CVS in the aisle. But I definitely have run into some problems with patients taking vitamins. They're not regulated very closely, so definitely a conversation you want to have. Fish oil and fatigue has been looked at as well. So this is a little chart looking at level of energy. And this is showing that patients who took nothing versus fish oil, the fish oil people had more energy, they had better well-being overall. I mean, you can see this is not knock your socks off the answer to fatigue, but it was statistically significant here. When they used the scale, it was a little less impressive, but in some measures of fatigue, fish oil seemed helpful. And you may have heard about fish oil for inflammation as well. So it's interesting to think about. Again, I don't think it's the answer for all fatigue, but it's what's out there in the medical community. Now this, I always hesitate to talk about. I always go to put the slide in and take it out because this is what we call in medicine proof of principle. And what that means is it's a study to try and help you understand something, but it winds up not being something that you would tell somebody to do. It just helps you understand a cause. So they actually took patients with lupus who are on stable amounts of steroids, and they actually had them either take a very low sugar diet or a very low calorie diet. And by low calorie, I don't mean just a few hundred. I mean, like not really compatible with living and feeling good, okay, for any long period of time. But the idea, I think, was to see if you could slow down people's metabolism, if that would help with fatigue, and it did. But unfortunately, this is not something we can really ask people to do, and you would be miserable if you did it. But it certainly is an interesting, makes you think about, in general, where maybe medicine should go in terms of looking at, you know, what we put in our bodies and how that really affects our well-being. Exercise and fatigue, of course, that's a very important topic. I always encourage my patients to exercise. I think studies have shown universally that exercise reduced fatigue and lupus. and that it actually has no any bad effects. In fact, it improves it. And I think the way it really does that is by improving your overall conditioning. So if the muscles are in better shape, they're more efficient, right? It's sort of like if you oil like a mechanical machine, it moves better. So if your body uses oxygen better and is in good shape, you're more efficient in terms of how you use energy in the body. So I think deconditioning is a very important concept. And there is a researcher here who's very interested in looking at the concept of fragility and lupus and what that means. And, maybe you'll get the opportunity to hear from her. But people with lupus, the way they use energy and the way their bodies perform are just different. But I do think exercise can help overcome that to some degree. So how can you work with your doctor to improve your fatigue? And that's really what it comes down to. So this is what your doctor can do. They can rule out lupus activity. They can look for and treat the other medical conditions we talked about that might be causing fatigue, rule out things, rule out anemia, rule out thyroid, look at your medications, try and figure out, are any of those causing fatigue? Can we tweak those or change them? We should be helping you improve sleep. Do you need to be checked for sleep apnea? Should we dose medications or steroids differently? Can we use medications for short periods? These are all works in progress all the time with our patients. And what can you do? Well, I want to encourage you to just shorten that to-do list because you only have 12 spoons. So I guarantee you, if you, like me, have an app with little boxes that you check off, it's just way too long. So I tell patients that list, just knock the bottom 5 things off because they're not that important and you're not going to get to them. So why feel bad about it? And think about things that can help you maintain energy. If you're doing housekeeping, can you use a shopping cart for groceries? Like, it's not just an old person thing. I use a shopping cart every time I go because I don't want to carry all that stuff. Or I have it delivered, if you have the option of sending laundry out or putting it in the cart. Can you store foods and freeze them so that you don't have to put in so much energy every time you have to make a meal? Think about exercising. If your doctor thinks it's okay with, where you're at medically, really think about doing that because we know exercise releases endorphins. These are chemicals in your body that actually help with pain and increase energy. And think about other things. These are things that you can probably talk about in the group: meditation, cognitive behavioral therapy, yoga. I think there's something out there for everyone, but these types of things have really, in randomized trials, shown it works. And some of the data looks much better than some of the drugs we give patients for certain things. So don't rule it out. Make sure you eat right. It's important to make sure, that I think what somebody always told me was a little of everything is probably the best, not any one, too much of one thing. But patients who have kidney concerns, really should talk to their doctor about the mix that's right for them, because sometimes protein's not right for everyone. But I think a balanced diet's so important, and following your body's clues for rest. If you're tired, there's a reason why your body's telling you to rest. Develop good sleep habits like we talked about, going to bed at the same time, minimizing interruptions, and don't be afraid to ask family and friends for help. You may be very independent, but they also care a great deal about you and would love to understand what they can do for you. I'm sure many of you feel that, oh, they don't understand what it's like to have lupus. Oh, they definitely don't understand, but if they care about you, I'm sure they would like to understand. So, you know, don't be afraid to say, you asked before what you could do. And one thing that would really be helpful, if you're on the way home tomorrow, if you can pick up milk for me, because I'm not feeling that great. I would love it if a friend asked me for something like that. It's so easy. And I know it would be such a big help to somebody. It would make me feel great. So think about who in your life you can reach out to. Acknowledge fatigue exists and you can't always control or predict it. So just remember that taking time off for rest or fatigue may be necessary. Just don't be hard on yourself. You're human. We're all human. Even those of us who look superhuman, we're human. When we're off camera, we're also struggling with some of these things. So, and just accept others won't understand your fatigue. I think people spend a lot of time wanting to convince people what it feels like, or they're just not. That's just what it's like to be human. If you haven't experienced it, you probably won't understand. And that's okay. That's why you're here with this group, because this group understands. So, that you may have to accept some compromises. And please make sure to let your doctor know that fatigue is really important to you and bring it up in the conversation. Ask what you can do about it. And I just wanted to offer a few ideas for those. Actually, this should be revised because the workplace has become everywhere. I think the workplace is home. It's taking care of kids. It's having a family. It's sometimes virtual work. Sometimes it's actually going to a building, but whatever you're doing, you're all working during the day. Take frequent breaks from what you're doing and just get up and stretch and walk. Don't forget to eat little, small, nutritious snacks, boost energy. And think about whether workplace adaptations can help. Sometimes a physical therapy assessment can be done to help improve your workplace, but also, to maybe have a conversation with your boss about changing your schedule, starting your day maybe a little later and ending later. I've had some patients who are valued employees and they just said, I have a lot of stiffness in the morning. Can I come in at 10 and just work until 6? And it worked out for this person and it's really changed their life. So I think there's usually one or two agreeable people in the workplace. And also I should just add that you actually do have rights. So if you have an HR department, I hate to be confrontational, but they're actually obligated to help you. So you shouldn't feel that they're the last resort. Often they should be part of the conversation from the beginning because they're really obligated from a legal perspective to make accommodations for you of some sort. I guess this is sort of redundant, but just to summarize, what you need to do is just recognize fatigue in your life and think about how you can adapt to it, work with your doctor to identify all the factors that may be involved in your fatigue, and be kind to yourself. Remember that fatigue is not laziness. It's just like any other symptom. And if you're going to be addressing your rash, you should be addressing your fatigue just the same. And I think we, meaning medicine, we obviously just need to keep working on better ways to measure fatigue, but also be better at opening the conversation and thinking, sort of using those flow diagrams to think more broadly about fatigue so that we can give effective treatment strategies to our patients, and just ask about patients more about their fatigue so that we communicate that we think it's important and that it's a priority, because if you're not treating it, you're really not fully treating lupus. These are just a few references. I've actually read these all. I think they're all great. It's a lot of reading, but it's, if you're in the bookstore or on Amazon, you can kind of flip through or and see which one appeals to you. I think Sarah Gorman is a very patient-centered writing, so that I think often appeals to patients. But the Coping with Lupus book kind of goes through, it has various chapters on different things that need to be sort of dealt with. And the Sick and Tired of Feeling Sick and Tired is sort of a more whole, I don't want to say holistic, but it deals with more the thoughts that people often have when they're dealing with a chronic illness, and learning to understand that those thoughts are okay. So these are all very complementary. They don't really overlap. So I'd love to hear if you have questions. I'm happy to take them. And I really want to thank you for letting me talk about this topic, because I think it's just really important and something I'm very interested in. So thank you so much for having me.